The drug trap. Some ideas regarding substance abuse. This paper considers substance abuse as a problem that ultimately is related to obstacles in the process of individuation. More precisely, addiction is in my view a symptom in a pathology that has hardly anything to do with physiological reasons, but that indicates a blockage or obstruction in the individuation process. As a result of this insight, my focus when helping addicted persons is not the drug, but the web of problems that cause many of us to crave for altering their consciousness. The reason for addiction most often is to flee a reality that one finds more or less insupportable. This desire is not pathological. In a society that basically has lost its humanity long ago, it's no wonder that intelligent and sensitive people want to shift their reality and find ways to drop out. This desire is rather a sign of psychic health. Or the other way around, and as Krishnamurti put it, it's not a sign of psychic health to be well adjusted to a profoundly sick society. This shift of focus at the onset of the therapy makes for the difference of this form of treatment in comparison to a multitude of drug treatments out there. Treating a drug with drugs is as effective as fighting war with war. And yet that's exactly what is done in most conventional drug addiction treatments. It shows the fundamental weakness of modern Western medicine, the mechanistic approach that treats symptoms without even remotely understanding the underlying cause. From observing my inner movements, the ways that my emotions and fears affected my decisions, and from observing others, I began already in high school to build a kind of work hypothesis that reads as follows. It is most probably not the alcohol, the drug or cigarette themselves where the problem lies with, but the inner need to have to consume, we have to consume them and to over-consume them until our health is gravely damaged. What then makes us so badly need and eventually abuse of these things? What is it that creates this need? Which is the lack that we try to compensate with consuming mind-altering drugs? My first intuitive answer to this question was that we need drugs for pleasure reasons, because it's pleasure that is lacking in the lives of most of us. I scrutinized the lives of people who are addicted to hard drugs and found that they all have in common that they lack out on a satisfying and fulfilling sex life. While many of them reply that they of course need to fuck as everybody else, they have a rather limited view of sexuality and generally of law, often associating sex with aggressiveness or judging sex as something animal-like or brute. And when you have such a starting point in your feeling level about sexuality, you can never, have a fulfilling sex life. That's impossible because conscious behavior and unconscious internalization of such behavior clash and are so divergent that they fragment the person. And as we cannot live without sex, apart from some rare species called yogis or saints, we have no choice here but to work on getting our conscious behavior and our unconscious internalization of it in alliance. That means, in short, getting the negative thought forms about sex out of our unconscious. These thought forms have invariably been built during childhood and youth, and are the result of a life-denying and body-hostile education.